Good evening to you and your viewers.
Thank you very much. Dr. Mathebula, perhaps... Thank you very much. Dr. Mathebula, perhaps we can start with you. I mean, at first it must have been quite frightening, I guess, for all of you when the virus started spreading across the province and the country. Talk us a bit through that.
Yes, it was quite frightening. In the beginning, we saw the decline in number of patients visiting the emergency department and the hospital in general. And that can be accrued to the fact that, most people were not so familiar with the virus itself. And most people were actually afraid to go to the hospital because they thought they are going to contact the disease there. But as community and people became aware of the virus and, each one of them or each family member or a colleague or someone they know became infected, and the people became reasonably aware that, this is a virus that can be treated. And they actually regained the confidence in the fact that, they knew that when they are sick, they are supposed to go to the hospitals instead of avoiding going there. So now that we are on level 2, we've seen, a change in the behavior of the patients and the community in general. So things are starting to normalize. People don't stay at home until they become complicated and develop complications. They visit the hospital earlier.
And Dr. Khosa, for you, I mean, how has this changed the manner in which you and your colleagues go about doing your work and your lives in total?
Yeah, the biggest challenge really has been the significant negative impact that the virus has had, not only to us as healthcare service providers, but also to society in general, where, patients were very reluctant to come and see us. Patients were very reluctant to go and see their specialists for their chronic illnesses. So just by virtue of all of that, it really did significantly negatively impact our model. However, this has really been a learning curve for all of us. So there are really significant benefits or opportunities, so to speak, in that we've been able to adapt to newer, innovative ways of doing, of delivering healthcare services to our patients. And on that note, it has also been really a tough experience, especially for our specialist community, because patients don't only come to visit us in our ER units, where you have really had to adapt very quickly, make decisions very fast, and, learn out of the whole exercise.
Yeah. Dr. Mathebula, fatigue, is one of the issues that we've spoken to quite a number of doctors about. Has the rearranging of your schedules perhaps worked in the favor of doctors and nurses? The hours are extremely long, and having to deal with a pandemic of this nature is certainly new to everyone.
Yes, for sure. In terms of staffing, what we've tried to do is we've actually changed the whole scheduling program in such a way that it allows people to get enough time to rest. For example, our staff members go on for 7 days and they get off for 7 days. We do that in order to accommodate, the fact that if they get infected, they have enough time to self-isolate at home. But obviously, we do work long hours. The numbers of patients have increased, so fatigue takes a serious toll on us in general.
I mean, this must have affected your families too. I mean, their concerns over your health working in that environment. That must have been extremely stressful to them. While you're at work, you're dealing with stresses of your own, but that certainly translates into your families as well, Dr. Khosa.
Yes, of course. It has really been a challenge for our families, because now we have to adapt to newer ways of, having to reassure them. They are used to you going to work and coming home. Now you have to adopt certain behaviors and practices, which are fairly general and standard, which is basically the same standards that we try to ingrain into our patients and into society. That, hand washing, sanitizing, masks. But now it's pretty different when you get home, because now all of a sudden, you have to use another entrance. You have to sort of shower and so on and so forth. It has been quite strenuous to families, but also really to society in general. We have seen a lot of patients also, presenting with stress symptoms, financial stresses, stress just by virtue of them having to go back to work, having chronic illnesses, having a family member that has got the condition. And it's our job, obviously, and to reassure them, to ensure that we make them understand the nature of the illness, destigmatize where we have to do so.
Dr. Mathebula, I'm sure you would share the same sentiment, but for you as doctors, do you think there'd been sufficient protection on your part? I want to talk about personal protective equipment. Did you feel as doctors in the front line enough had been done to protect you to be able to carry out your duties?
I guess it varies from one institution to another. Where we're working, honestly, we covered on that front. We have actually changed the flow in the hospital. So we've divided the hospital into green zones, yellow and red zones. And we allocate patients according to their status, their COVID status. And we are very, very fortunate because our hospital where we're based, it's relatively new. So all the partitions are actually solid wall. And every time you treat a patient, before you move in the next patient, we've got a robot that we use to decontaminate the whole area before you move the patient in. So in terms of protection for our staff, for our nurses, for our patients, I think everything is above board.
Dr. Peters, Mathebula and Dr. Rhulani Khosa. Yeah, please go ahead. Yes, we do have a minute. Please go ahead.
I was just saying, just to add, I think the biggest gain for us as an institution, like he quite rightly puts it, that it would vary from institution to institution, is that in the past 5 months, there's been a lot of adaptation and learning, and our institution has been very supportive to both the staff and even patients in terms of ensuring that they are protected. So in terms of the flow that Dr. Mathebula is explaining, it doesn't only start from the front line at the front desk, but it extends right through into our theaters, our ICUs. So we've really adapted quite nicely to the new way of delivering healthcare.
And I think to both of you doctors, thank you very much. I think I speak for many South Africans. Thank you very much indeed for your service. And of course, many others who are in the front line, Dr. Peters Mathebula and Dr. Rhulani Khosa. Doctors are running the emergency department at the Netcare Pholoso Hospital in Polokwane. Thanks indeed for your time.